Good morning, students. We are going to discuss one important topic regarding the ventilation, that is mechanics of ventilation. In the previous session, what we have seen is the process of respiration and what are different parts of respiratory mechanisms which work together to happen the process of respiration. And in that, the first stage of respiration was ventilation. So today in detail we are going to discuss this mechanics of ventilation. Ventilation literally means the movement of air in and out of the lungs and the atmosphere. So there's an exchange, and this particular exchange at that movement is known as ventilation. Under these headings, we are going to discuss this particular topic: pressure changes during the ventilation and the muscles of respiration. The muscles of inspiration as well as the expiration. We're going to record the separate two videos for this, but remember the examination. A long answer question is always asked of the mechanics of ventilation, and in that you have to write regarding both the factors, the pressure changes and the muscles of respiration. How both of these are going to contribute in the process of ventilation. So first we will see the pressure changes and airflow during the breathing. But before discussing that, let us see how the ventilatory pump is comprised of. As we have seen in the previous session, the lungs, the chest wall, the intercostal muscles, the pleural lining, and the diaphragm, all of these factors will be contributing in forming the ventilatory pump. The lungs are housed in an airtight thoracic cavity, and this thoracic cavity is separated from the abdomen by a large dome-shaped skeletal muscle, which is the main primary muscle of respiration, that is diaphragm. This rib cage is thoracic cavity is made up of 12 pairs of ribs, and anteriorly they are attached to the sternum. And in between each of the ribs, there will be intercostal muscles. Two types of intercostal muscles are there: internal intercostal and external intercostal. The rib cage posteriorly is joined with a huge joint to the vertebral column, and this will be allowing the movement of the rib cage either raised condition or lowered condition during the process of breathing. The space, as we know or we have discussed, that there is a small tiny little space in the tiny little fluid, that is pleural fluid in the pleural space, is also having the function of lubricant so that the lungs can slide against the chest wall. So all of this complete structure will be contributing in the process of ventilation. Now this ventilation, if it has to occur, the first important thing what we have to have is there should be a pressure gradient. And this pressure gradient should be created such that at one end the pressure should be higher than the pressure at the other end of the tube. And then only the air will be flowing from a tube or the airway. Now, as we always know that air will always flow from higher pressure point to the lower pressure point. Now, what will happen during the inspiration? Now, in the inspiration, you have to create a negative pressure inside the alveoli as compared to the airway opening, that is nasal cavity or the mouth cavity. So these are the two ends, and we have to create a pressure gradient. And such pressure should be created that we have to suck inside the air. So movement should be from the nose to the alveoli. So the alveolar pressure should be less as compared to the nasal cavity. And just the opposite should be created during exhalation. The pressure in the alveoli should be higher than the pressure at the airway opening. So due to this pressure gradient only, the movement of air will be possible during inspiration and expiration respectively. Now, whatever parts of the respiratory system, they will be contributing in creating this pressure gradient. So what they will do during inspiration, they will create a negative pressure inside the thoracic cage or inside the alveoli so that the air will move in. And during the process of expiration, they will create a pressure gradient so that the air will be moved out. So whatever mechanisms which are contributing in creating the pressure gradient, that is mechanics of ventilation. Now remember always that these gas tensions are measured in millimeters of mercury, but sometimes the pressure gradients are so small that they will be denoted in centimeters of water pressure. If you refer Reynolds on all Harrisons, then it will be given in the centimeters of water pressure only. You have to remember both the values and because they are very much important. The pressure of 1 centimeter of water is equal to 0.74 millimeters of mercury. And they always will be reference to atmospheric pressure, which is considered as a baseline value. And it is designated as 0 centimeters of water or 760 millimeters of pressure at sea level. Now, what will happen during the inspiration and expiration? Now, as we have seen that we have to create a negative pressure inside during inspiration. So this is your thoracic complete structure, and whole of the structure will be such activated that there should be a creation of negative pressure. Now, how we can create? Again, the body will follow the physics law. So what it will do, it will try to increase the diameters of this thoracic cage. So either the vertical diameter or the anteroposterior diameter, the transverse diameter, all these three diameters will be increased so that there will be expansion. And we know that if there is an increase in the size, the pressure inside that will be negative. And this is how the body also uses this factor, and the muscles will be activated such that there will be expansion of the chest cage during inspiration, creating a negative pressure gradient. So what happens during inspiration is that this is the muscle, major muscle of inspiration, diaphragm, which is always dome shaped. Now, if it is contracting, it is flattened. So it becomes somewhat flattened. And if it is flattened, it will go downwards. So that will also push the abdominal content downwards. And due to the flattening, there is an increase in the vertical diameter. Along with that, there is also a rib cage movement which is outwards. So as it is going downwards, this rib cage, which is here at this particular position, will be also increased in or moved in outward direction, and that creates an increase in the diameter, transverse diameter. And due to the rib cage movement, this sternum will also will be moving in anterior direction. So that antero-posterior diameter also will be increased. So all these diameters due to the contraction of the muscles will be increased, and that causes a negative pressure gradient and helps in the process of ventilation. This occurs in the resting condition, but if you require deep and heavy breathing, the accessory muscles also will be contributing, like the external intercostal and sternocleidomastoid. Now, the basically whole of these accessory muscles or the mechanism, what they are going to do is they will try to increase more the size of rib cage. So they will try to pull the rib cage upwards and outwards so that the transverse diameter also will be increased along with the anteroposterior diameter, and thus helps in the process of ventilation. Now, in expiration, normally the expiration is just passive. So there is no contraction of any muscle. So what happens is diaphragm again becomes dome shaped, and just it relaxes and returns to its dome shape. And due to that, the rib cage is also lowered back to normal position. And this decreases the diameter, which were increased. The vertical diameter also decreases. So this is again decreased to normal. This again becomes at normal position. So this transverse diameter also decreases. The sternum again achieves the normal position. So the anterior posterior diameter also decreases. And that creates a pressure which is more than the airway opening pressure, and it moves the air out from the lungs. During forced expiration, sometimes it requires the assistance of another muscles, that is internal intercostal muscle, which contracts and pulls the rib cage downwards and inwards, so that there is again more decrease in the diameter. The abdominal muscles also contract and help pulling the rib cage downwards, compressing the thoracic volume and thus helping in the process of expiration. So this is how the mechanics of muscle activity will be creating the pressure gradient. So these are the important pressures which you have to remember. The mouth or airway opening pressure, the alveolar pressure, the intrapleural pressure, the body surface pressure, and the airway pressure. So all these five pressures are very much important. And these, the right side, there are the differences in these pressures, and which you have to remember these pressures because uh, unless a pressure gradient is created by any of these factors, then only the ventilation is possible. Now, many a times you must have seen or you must have heard that ventilators are used. Why these ventilators are used? Because there are certain disorders like muscle failure, respiratory muscle failure, or nerve paralysis, or the pressure which is in negative pressure is not generated. In these conditions, these pressure gradients will not be created, and the normal process of ventilation will be affected. And in these conditions, we have to use the mechanical ventilators to assist the process of ventilation. Now, these pressures we are going to see in detail. First is intrapleural pressure, which is the pressure in the potential space between the parietal and the visceral pleura. It is normally about -5 centimeters of water at the end of expiration, and at the end of inspiration, it becomes more negative, that is -10 centimeters of water. In Guyton, they are given these values in millimeters of mercury. The alveolar pressure is normally changing with the pressure changing the intrapleural pressure. So during spontaneous inspiration, it becomes negative, that is -1 centimeter of water, whereas during expiration, it becomes positive +1 centimeter of water. There is one pressure which you have to remember, that is trans-airway pressure. So it is the pressure difference between the airway opening and the alveolus. Now this pressure gradient is very much important to produce the airflow in the conducting airways. So we have seen that the generations of bronchi and bronchioles. So up to the 16th generation, there was only conducting pathway. So this conducting pathway, the airflow must be generated. And to have the airflow, again, there must be a pressure gradient. And this pressure gradient will be responsible for the movement of airflow in the conducting pathway. This is the pressure which is generated to overcome the resistance to gas flow in the air. So this is also important in overcoming the resistance. So there are so many things which the diameters, the contraction, the dilatation, these all will be contributing in the resistance. And this pressure has to overcome this resistance, and then only the airflow will be normal. Then you have to remember regarding the transthoracic pressure also. It is the pressure difference between the alveolar space or the lung and the body surface area. And this is the pressure required to expand and contract the lungs and the chest wall at the same time. So if there is the pressure difference between these two, then only the expansion and contraction at one time will be possible. This is a relationship of the lung and the chest wall forces. You have two layers of the pleura. So these are the two layers, parietal layer and the visceral layer. And we know that the chest wall forces and the lung recoil forces, they act in opposite direction. And due to that opposite direction forces, there is a negative pleural pressure which is generated. And this helps in the stoppage of collapse of the lungs. So lungs actually have the natural tendency to collapse due to two factors. First, due to its elastic nature, and second, actually first is due to surface tension forces, 2/3, and elastic fibers is 1/3. They will contribute in the tendency to collapse. So if you like you remember the rubbers, okay? So if you are stretching your rubber elastic fibers, they will again go back to normal tendency. So that is 1/3 fiber. So lungs are made up of fat, so they do always have the tendency to collapse. And the second thing is surface tension. Again, remember your physics lectures. The surface tension is that attraction of molecules in between them. So due to that attraction of the molecules, they will come closer. and these forces will be total. And due to that, the lungs always have a tendency to collapse. But that doesn't happen. So why? Because there is a negative pressure which is created due to this pleural space and the suction. So in the quiet inspiration, the chest wall is tending to pull away from the lungs, whereas in the lung will be pulling in the opposite direction. So inward pulling will be there. And that creates an intrapulmonary pressure of minus 6 millimeters of mercury, which can be increase up to minus 30 millimeters of mercury during post inspiration. Then we have transpulmonary pressure, which is also known as transalveolar pressure. It is the pressure difference between the alveolar space and the pleural space. This is the pressure which is required to maintain the alveolar inflation. So again, it is very much important because alveoli should not be collapsed. They should be always be maintained, and that maintenance of alveolar inflation is possible due to the presence of this pressure. The all modes of ventilation, they will increase the transpulmonary pressure during inspiration, either by decreasing the this transpulmonary pressure or increasing the alveolar pressure. So these ventilation will try to do either negative pressure ventilators. If they are using, then they will try to decrease the pressure, and if they are using the positive pressure ventilators, then they will try to increase the alveolar pressure. But the pressure difference should be maintained at that particular level so that the alveoli should be inflated. Now, these are the things which you have to remember at the time whenever you are using the mechanical ventilators also. So the physics principles are very much important in maintenance and regulation of these ventilators. You can Google it and find out how the ventilators are working. Our human breathing is negative pressure ventilation, whereas the ventilators, they provide the positive pressure breathing. During negative pressure ventilation, the pressure at the body surface becomes negative, and this pressure is transmitted to the pleural space, resulting in creating an increase in the transpulmonary pressure. Whereas during positive pressure ventilation, it becomes atmospheric. It remains at atmosphere. But the pressure at the upper airways and the conducting airways, they become positive. And this alveolar pressure then becomes positive and the transpulmonary pressure increases. So by any of these two mechanisms, what they are doing is they are increasing the transpulmonary pressure so that the alveolar inflation is maintained either by negative pressure ventilation by creating less negative pressure or by positive pressure ventilation by becoming remaining the atmospheric pressure at the upper airways. So this is how the transpulmonary pressure is maintained. So during inspiration, the pleural pressure goes from -5 to -8 centimeters of water. The transpulmonary pressure will be increased. So that increases the transpulmonary pressure and the lungs will be inflated because negative pressure will be pulling inside the air and the lungs will be inflated. The alveolar diameter will be increased, the alveolar pressure is decreased, and that will be decreasing in the alveolar pressure. So if you see during inspiration, the alveolar pressure goes on decreasing below the atmosphere. This produces a pressure difference between the mouth and the alveoli, and that pressure difference. So the pressure here and the pressure here. So that pressure difference will have the volume to be changed and the air will be gushed inside the alveoli. So airflow will be stopped at the end of inspiration because the alveolar pressure again becomes at atmospheric level. So when it reaches again at the atmospheric level, the airflow automatically will be stopped. But during expiration, the inspiratory muscles relax, the rib cage drops, the pleural pressure becomes less negative, and the transpulmonary pressure will be decreased. So this difference which was created in inspiration is now gone. So this is what is the end inspiration phase, and the lungs will be deflating. So the alveolar diameter will be again decreasing. The alveolar pressure becomes greater than the atmospheric pressure, and the air will be pushed. So this is what is happening. So alveolar pressure goes on increasing, and this change in the pressure that will cause the air to push out of the lungs. The airflow out of the lungs occurs until the alveolar pressure equals the atmospheric pressure. So this process will continue till it reaches the atmospheric pressure. So that is how it is maintaining the pressure. So first we create the pressure gradient, and then the movement of air will try to balance this. Until it is balanced, the process of inspiration and expiration will be continuously going on. So the during inspiration, the atmospheric pressure is more than alveolar pressure, it is -1, and during expiration it becomes +1. Now this is the figure from the Guyton which we can see that this is the alveolar pressure. From 0 it becomes -1 during inspiration, and the pleural pressure, it is decreased, so it is in centimeters of water again, so it reaches around 10 or 40, and this difference is known as transpulmonary pressure. And due to this transpulmonary pressure, a negative pressure gradient is created, and air will be sucked inside, which increases the lung volumes. Now, at the end of inspiration, again this difference will be lost. So this alveolar pressure becomes positive, and the pleural pressure again reaches at the baseline, and that change will cause the positive pressure at the alveolar surface, and that moves the air out of the lungs, causing the expiration to happen till it reaches the normal baseline. So this continues till death. And this is the process in detail. Inspiratory muscles will be contracting, causing the thoracic cavity to expand. The pressure becomes more negative. And due to that, the transpulmonary pressure increases and the lungs will inflate. The alveolar pressure becomes subatmospheric, and the air will be flowing inside to cause the inspiration. And this is the mechanism of spontaneous ventilation and the resulting pressure release. So during inspiration, the air will be moving inside. So this is how it is again the lungs movement, the chest wall movement, and the diaphragm movement that will create a pressure gradient. So intrapleural space, this pressure and this pressure gradient will be created minus pressure gradient, that is negative pressure gradient, and the air will be sucked inside. Whereas during exhalation, the opposite direction, the mechanics will be activated in opposite direction, and they will create a positive pressure and as compared to the nasal opening, and the air will be flowing out during exhalation. So this can happen, or this is what is happening during the process of ventilation. So I will stop here and I will record another session for muscles of respiration. Again, I'm requesting that this is very important topic. To go through the topic is not only important for the exam point of view. All of you now know that ventilators, they are so much important, and the ventilation process is so much important. So for understanding this purpose, at least you should read this particular topic very carefully. Thank you very much.